and welcome. I'm Nayantara Rai. Today on the episode, we have a very special guest. It is Dr. RS Sharma, the CEO of the National Health Authority. We're getting him here to talk about the Ayushman Bharat Digital Mission launched by the Prime Minister. And the question is the UPI moment for healthcare here? Every citizen is going to be given a 14-digit unique health digital ID. The Prime Minister's promise that this data is going to be secure. It's going to be linked to your medical and health records. It can be shared with hospitals, diagnostic labs, with doctors. There will also be a repository of doctors and healthcare workers. Why is this the moment, the UPI moment for healthcare? How will your life change with it? I'm going to be talking to Dr. Sharma just about that. Thank you so much for giving us the time here on ET Now. So my first question to you, sir, is, and as one of the architects of the Ayushman Bharat Digital Mission, why are you calling this the UPI moment for healthcare?
Well, thank you, Nayantara. Thank you for inviting me on ET Now. I think it's a very important question which you have asked as to whether it is UPI moment or not. In fact, we are calling this entire architecture as UHI, the Unified Health Interface. And the whole idea is that it should, maximize the leveraging of technology in delivery of health services. As you have seen, we have passed through a very difficult time, and people have, realized that how much important health services are. And also people have realized that in these times, technology has, in a way, come to the rescue of the people because, people are using telecommunications, people are using teleconsultations, and doing a lot of digital, means to get the services. We are lucky in a number of respects. One is that we have a very solid communication infrastructure, which the Honorable Prime Minister referred to in his speech yesterday, that we have 118 crore mobile connections, we have 80 crores internet connections, we have 130 crore Aadhaar numbers. So we have a very good digital identity, digital infrastructure. Now that digital infrastructure must be leveraged to provide the delivery of services to our people. And therefore, I think what is important is that we are creating a network of service delivery through the Ayushman Bharat Digital Mission, which will ensure affordable, equitable, quality services, health service to the people.
Can I ask you that when you launched the Ayushman Bharat Digital Mission, you and everybody else who's been involved with it talk about affordable healthcare. How can you say affordable healthcare? The mission is not going to change the prices of healthcare. It's not going to change what hospitals want to charge, doctors want to charge, diagnostic labs want to charge.
Oh, certainly. That's again a question. The question is, it will certainly reduce the cost of healthcare. How will it do that? Let me give you a couple of examples. One is that when you are doing teleconsultation, obviously the patient is not going to travel, so his time is being saved. And therefore the transportation cost is going to be saved. That's number one. Number two, he is able to, search the doctors sitting somewhere in remote area. He can still consult a doctor sitting in Mumbai. That itself is a great advantage the person will have, number one. Number two, delivery of prescriptions, delivery of medicines, etc. will also become, he will leverage the internet connectivity to get that done. So I think that way it will make it certainly affordable. It will certainly make it accessible because now the geography becomes much less important than it was before. And obviously the quality it will be there.
I take that point. I take your point in that it is going to be accessible. I wanted to understand how you could say affordable. Now, I'm going to ask you certain questions that a lot of Indians will have. Now, let's say I want to get a second opinion. will the hospital, the doctor, share my report, the diagnosis with the doctor I want to take a second opinion with?
Absolutely. That's again a very good question. The way we have orchestrated or the way we have designed this, the protocol is that the patient will be in charge of his or her own records, which means that she or he will be able to share his records or her records digitally with whomsoever he wants to consult with. So that's one part. Now he will not have to carry the whole burden, because the way we are visualizing is that all the health records will be linked to his health ID, and which will be available whenever he or she wants to access them. Not because we are assimilating them anywhere in our data centers, but because he or she will be able to either keep them on his or her mobile, or even if she does not keep on the mobile, then the records can be fetched real time from wherever they are. So they will remain wherever they are, but they will be available for viewing and sharing.
Okay, so it can be shared between hospitals, from a diagnostic lab to a hospital. Basically, patient goes from doctor to doctor or hospital to clinic. The information, the data can indeed be shared. Dr. Sharma, what is going to be are you going to also include financing, insurance, payments on the platform? Is that the end game too, to make it a complete integrated platform when it comes to healthcare?
You see, what is happening is that integration should not be understood in the context of collecting everything on the same platform. Digital artifacts, can be interlinked or connected through what is commonly referred to as the APIs, application programming interfaces. So, for example, we have, let's take an example that a person is consulting a doctor. Now, first of all, when he's consulting a doctor, he needs to have a teleconsultation process, which will be there on the platform. The platform will facilitate the teleconsultation. Obviously, the bandwidth will have to be paid for by the patient or by whosoever is facilitating the patient. However, then the next thing is the doctor, advises him, and then the doctor has to issue a prescription. Now, fortunately, in India, we have an artifact called e-sign, which means that doctor can digitally sign the prescription and can share. Then, of course, you have UPI. Through UPI, a person can digitally pay the doctor. And therefore, what is happening is that we have all the components and elements of transaction already developed in our country. And they are going to become the building blocks for orchestrating the service delivery.
Okay, so that's the sandbox of sorts, that was created. So tell me, Dr. Sharma, we're seeing so much innovation, so much growth of our startups. They've been talking about health tech. It's been a space where you've in fact seen a lot of M&A activity and fundraisers as well. What role can startups and entrepreneurs play when it comes to the Ayushman Bharat Digital Mission?
Oh, wonderful. Again, a very, very interesting question. You see, what is happening is, till now, if you want to, operate in this space, then you have to build end-to-end product. Giving an example, suppose you want to do a e-pharmacy. Suppose you want to do, sell the medicines on the platform. Then you have to have some doctors on your roll. You have to have some people who should download your application and should use your application to get the medicines. So you have to build the entire pipe yourself. Now, what is going to happen is we will have a ready-made registry of pharmacies. We will have a ready-made registry of doctors. We have a ready-made registry of drugs. So the person now, anybody who is developing an application, any startup, will have a ready-made, things available, ready-made reference data available, and he or she will not have to, assemble everything himself. So therefore, the startup will be able to have a plug-and-play game and will be able to, use the entire network on the platform in a seamless manner without doing much effort or without, they focus on their product and their innovation, and the rest of the platform is available for them for asking. So that's actually going to be a gold mine for
Do you already have applications from startups? Like when you did Cowin and the vaccination, for example, Farm Easy, Healthify Me were one of the first few startups that had come to you. Have startups, unicorns already approached?
Absolutely. We already have a number of people, number of entities who are in our sandbox. We have more than 400 entities working with us on our sandbox, because in the last 1 year or so, when the Honorable Prime Minister launched it for 6 union territories, we have been working on this entire platform, and basically we have made it completely open, API based, similar to what we have done with Cowin. Now, Cowin, from the beginning itself, we have made it absolutely API based platform so that it can be connected. Similarly, this also will be, we will be publishing the APIs, we will be publishing the basis on which you can connect and you can onboard on this platform. And there are many entities which are already working with us to try out their solutions on onboarding on the digital platform.
Speaking of Cowin, Dr. Sharma, will Cowin and Ayushman Bharat Digital Mission ultimately merge? Will we need both the platforms?
So actually, lot of synergy is going to happen in many of these platforms. For example, Cowin, we have the Arogya Setu. Now, Arogya Setu will become your personal health record application in some sense, because Arogya Setu is a very, very popular application. So now, from the contact tracing, it is already working as a front application for Cowin. It will also start working as an application for searching, booking, the teleconsultations, booking the time of the doctors, etc. For this digital health, digital mission also. So I think a lot of these applications and platforms are going to come and on board of this platform.
Okay, so there are obviously going to be synergies. Arogya Setu, from what you're telling me, is going to be the leader and the front runner when it comes to all of our health and digital records. My final question, Dr. Sharma, when the Prime Minister promises that all of our health records, medical records are going to be safe, you have obviously assured him of that. How is that going to be?
No, Nayantara, one of the things which we should understand is that this particular platform is not going to assimilate all the records. The health records are going to remain wherever they are. So, for example, if you visited Apollo Hospital, your health records are with Apollo Hospital. The next time when you visited Max, then the health records are with Max Hospital. Or if you did teleconsultation with the doctor, then the health records are with you on your phone. So essentially, we are not going to collect any of your health records. What we are going to do is to enable every entity participating in this ecosystem to make these records available as and when the patient wants to fax them. That's the whole architecture. So privacy burden, so to say, on this particular platform become much less. However, let me assure you that whatever data this platform will have, whether it's the data of the doctors, of professionals, etc., that is going to be completely safe and secure with us.
Dr. Sharma, you had promised me 15 minutes, and I won't take up more of your time because I know I'm going to need more interviews in the future, and I know better than for you to be cross with me. So thank you so much. The idea was to have you on ET Now to explain to the citizens on how exactly this unique health ID is going to work and why it is the UPI moment for healthcare.
Thank you very much, Nayantara, for having me on your channel. Thank you.